Thank you so much. So we'll open up with vitamin deficiencies, what to consider. So there's really a lot to consider when working up a micronutrient deficiency in any individual, especially those on nutrition support or parenteral nutrition therapy. And this is because micronutrient deficiencies do present and manifest in many different ways in different individuals. And it's not always textbook of what we can see in our charts or our graphs that we've seen presented in the literature. So some different ways that micronutrient deficiencies present include differences in neurological function, hematological, wound healing, gastrointestinal symptoms, fatigue, mood changes, bone health, skin or dermatological changes, alterations in heart rate or cardiac function, altered respiratory functions, and many more. The list really does go on and on and on. So you can probably see now why it's really not that simple to recognize micronutrient deficiencies or pick up on these in our clinical assessments. The reality is that what we see in practice is not always, again, seen in that classic textbook case. Nutrition-focused physical examinations, or NFPEs, which we'll talk about in just a moment, are really one of our key strategies to evaluate for deficiencies. When working up micronutrient deficiencies, it's important to go through a detailed patient history to collect your data, so you can put together that data to better analyze and assess for these clinical manifestations that may be present. Where's your patient in their clinical journey? So that's really the first thing to think about and start considering in your assessment. Are they recently post-surgery? Is there a new clinical diagnosis potentially impacting your patient's ability to digest and absorb nutrients? What is their absorption capacity potential at this point? Without this information or without really considering this in your clinical assessment, it can be really challenging for us as clinicians to properly assess a patient's nutritional status and then look at things like clinical manifestations of micronutrients. I do encourage you to really think outside the box when needed. So ask a colleague, ask a peer, ask a mentor that you may have for a second pair of eyes, especially these more complex cases in these patients whom are on nutrition support, even during times of national drug shortages, which we'll talk about in a minute as well, who have a lengthy clinical history and then present with these potential signs and symptoms of micronutrient deficiencies. These national drug shortages have impacted all of us at some point, especially more recently too. And we've even seen reported cases of harm and consequences of these nutrient deficiencies from withholding parenteral nutrition components or the inadequate dosing of certain vitamins and trace elements. Unfortunately, the literature that you can go back to and review, and we'll briefly touch on some of these cases in the Q&A, I'm sure. We even see death reported in some of these cases, specifically from thiamine deficiency due to cardiac failure. So nutrition-focused physical examinations, or NFPEs, these are, as a brief reminder, this head-to-toe systemic exam. These can be completed virtually, so those of you who are seeing patients in a remote setting, I do encourage you to not forget this component in your clinical assessment. So asking patients and really guiding them through this practice, they know their bodies better than anyone else in most cases. So empowering them to look out for changes to things like their skin, their nails, their hair, their fat, their muscle stores, etc. And really allowing them to and empowering them to be able to kind of coach back and teach back what they're seeing in changes of their body, which will only allow you to better assess and monitor your patients long term and collect these data and trending points. So moving forward to monitoring strategies, first off, we have to have awareness of this issue at large in order to monitor it and to trend it. If we're not aware, we're gonna overlook it as clinicians and as a healthcare system. So I want you to ask you and take a moment and reflect on a couple of questions as we go through this slide here on what your current monitoring practices and strategies are at your respective institutions. With that, we as clinicians must know and really understand and learn the function of micronutrients, what they do, and what happens when they're deficient or we're at risk of deficiency. So what can happen in patients? What are the clinical manifestations that come forward? This will allow us as clinicians to better determine who may be at risk of deficiency or who may already have developed deficiencies. I want to ask you, what are your best practice strategies that you're using in your respective institutions for monitoring? Or do you have policies in place to monitor for micronutrient deficiencies and repletion strategies? Do you have policies in place during periods of drug shortages? Are you working as part of an interdisciplinary team where you all are on the same page to monitor and trend some of these things? Are different departments doing different things in this respect at your institution? Of note, Aspen has developed parenteral nutrition shortage considerations, including the parenteral multiple vitamin products, in order to assist members and clinicians in coping with these PN shortages in our patient populations. The recommendations include both the rationing and conservation strategies for both adult and pediatric patients. It is difficult to confirm micronutrient deficiencies based solely on biochemical levels. So there's a lot of things that we have to consider. It's not always just looking at a blood work marker or a lab level, because the sensitivity and specificity may greatly vary. And there's a lot of other limiting factors to consider. So we really do have to look at the whole picture of the patient and their clinical trajectory when we're looking at these clinical manifestations and if deficiencies are present.
Be sure to watch for upcoming Channel One videos on nutrition and learn more from our esteemed colleagues. Have a great day.